Good morning, everyone. My name is Nikki Calloway, and I will be the leader for your group today. Today's group is titled Women in Wellness, an Addiction Medicine Perspective, and the focus will be on the 8 dimensions of wellness. Wellness for women in recovery requires a cautious effort to manage addiction while implementing healthy life choices. According to SAMHSA, wellness is being in a healthy mental and physical state. This implies that addiction recovery is more than just abstaining from their substance of choice, but also maintaining a state of wellness. Recovery doesn't only happen in a treatment facility, but can also be experienced through the daily life choices of a person. The road to recovery from addiction can be challenging. Every day is a struggle that can be encountered by stress, mental illness, and sometimes relapses. "90% of people recovering from addiction have a relapse. Although this statistic can present as being discouraging, relapse is not seen as a failure in treatment. Before going any further, I would like to address some of the group rules. First, being that everyone will be allotted a time to self introduce themselves and speak to their addiction, their recent struggles of recovery, and their last day of use. There will also be a brief review of the topic and goals, discussions led by myself, the leader of the group, and I would ask that everybody please present to group on time and be polite to others, allowing everyone to get time to speak and not interrupting each other. I would also like to say that everyone should be supportive of their peers and avoid any type of criticism, and please, no sideline conversations. We think that everybody's opinion is important and we would like to hear from everybody. I would ask that if homework is given, which I don't think there will be homework for this group particularly, um, I would ask that you do your homework, complete your homework, and please remember, by all means, confidentiality. What is stated as in group is to remain in group. Please express any concerns. Please bring them up in the group so that we can work through those things and address them in the group. And I would ask that everyone please keep coming back and attending the groups, allowing yourself a chance to succeed. Now we're going to go into the rest of our presentation. And what wellness is to a woman. A woman's wellness. Oh, this is such a nice topic. According to SAMHSA, there are 8 dimensions of wellness. The focus for this group is on women and their wellness and the differences that exist between women and men in recovery. As everyone knows, there are, I would hope that everybody is aware that there are some similarities, but there are definitely differences that we are going to be discussing and highlighting throughout this presentation. Dimensions of wellness. There are 8 dimensions of wellness according to SAMHSA. The 8 dimensions of wellness are emotional, physical, social, occupational, spiritual, environmental, financial, and intellectual. The Substance Abuse and Mental Health Addiction Services Administration, also known as SAMHSA, are specialists and agree that practicing wellness is a central component of the drug recovery process. The National Institute on Drug Abuse indicates that there is a 40 to 60% relapse rate among individuals who are in recovery from substance abuse. Knowing this, the truth is that recovery is always possible. A promising fact is that up to 60% of people in recovery don't relapse. Excuse me. Next, we will address some wellness stats. Some of the stats are 1 in 4 women are dissatisfied with their overall wellness. How many people in this room are familiar with this in terms of being dissatisfied with your overall wellness? I myself can speak to that. I have some issues myself in terms of weight gain, just not being able to get enough rest from work, kids, school, all that. It just kind of weighs you down. So I myself would have to agree that I am dissatisfied with my overall wellness. You know, there are some aspects of my wellness that I find myself, I basically find myself being satisfied with, but there are definitely some that I'm not in tune with. So, women face unique issues when it comes to substance use, in part influenced by their sex, which is differences based on their biology, and then also their gender. Differences based on culturally defined roles for men and women. Okay, so some of them culturally defined roles would be the mother being the mother. What are some other culturally defined roles that you can relate to in terms of men versus women? The woman being not considered the head of the household. The man is always seen to be, the power in the house. But, who's to speak to these single, mothers who are raising their children. So we have a lot of differences in that as well. Oh, excuse me. Have to go back to that. There were some things I wanted to highlight on that as well. So it is said that women who use drugs can have issues related to hormones, their menstrual cycle, fertility, pregnancy, breastfeeding, and menopause. In addition, women themselves describe unique reasons for using drugs, including weight control, fighting exhaustion, coping with pain, and attempts to self-treat mental health problems. How many in here can relate to any of those reasons as to their initiation to their substance abuse problem? We have a couple other definitions in terms of wellness. The World Health Organization states a state of complete physical, mental, and social well being, and not merely the absence of infirmity. The National Wellness Institute defines it as a conscious, self-directed, and evolving process of achieving full potential. It just gives you a different perspective on how people or organizations define wellness. So, what does wellness look like for you? When you envision someone who is well and healthy, what comes to mind? What factors do you think influence wellness? According to the National Wellness Institute, wellness can be compromised by lack of control, trauma, unhelpful thinking styles, chronic illness, disability, and substance abuse. So, substance use itself can influence your overall wellness. Being a patient on this unit speaks to that effect directly. In order to be admitted to this unit, part of the criteria is that you have a level of deteriorated physical health. You have to have a medical ailment by which it requires monitoring of a nurse and a physician. Lack of support. Individuals who tend to not, number of individuals that present here don't have family support, they don't have community support, social supports, so they lack in that area as well. A number of individuals who have been exposed to trauma, whether it be physical, sexual, emotional trauma. And then those who just don't think very highly of themselves, low self-esteem, you know. Individuals who may have been diagnosed with cancer or have contracted HIV, those individuals as well. So, as we know, wellness contains multiple dimensions, which I will state again: social, physical, emotional, intellectual, spiritual, occupational, financial, and environmental. According to SAMHSA, recovery is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Recovery speaks to wellness directly. If you're reaching your full potential, then you're at your optimum level of wellness. So, we're going to identify what wellness is, break it down a little bit. It's multidimensional, which we know. It has 8 dimensions, which we've already spoken to. And it can include your purpose in life, active involvement in satisfying work and play, joyful relationships, a healthful body and living environment, and happiness. I do a group where I actually ask you, do you want to be happy? So happiness is definitely, involved in your wellness. So wellness is important because it impacts the state of your physical health. For example, research shows that people who have mental disorders or are suffering from addiction tend to die years earlier than the general population. This is due to the negative impact on any of these elements that are in your wellness will that may be affected. So, say for instance, your physical health. If your health is not up to par, say you have diabetes, and then you add substance abuse to that, it could lead to the deterioration of your kidneys, your liver. We've had a number of people be admitted and have limbs, toes, fingers amputated, especially if they're a heroin abuser. A lot of times those individuals end up with loss of limbs. So that would definitely be a negative impact. Wellness is important. Why? Why do you think wellness is important? What do you think wellness does for you? It impacts the state of your physical health. For example, people who have mental disorders or are suffering from addiction tend to die years earlier, as we stated before. And as a result of a negative impact of, as we stated earlier, smoking, unhealthy weight, substance use side effects, and lack of adequate health care. All of those are components that contribute to an individual's deterioration of wellness. So we're going to go to the first dimension, which is emotional wellness. And SAMHSA identifies emotional wellness as the ability to cope effectively with life and build satisfying relationships with others. People with healthy emotional wellness feel confident, in control of their feelings and behaviors, and are able to handle life challenges. They are able to work through life challenges, can build resiliency as we learn that setbacks can be overcome. Emotional health can be maintained and improved by engaging in regular leisure and recreational activities. Women often use substances differently than men, such as using smaller amounts of drugs for less time before they become addicted. Women can respond to substances differently. For example, they may have more drug cravings and may be more likely to relapse after treatment. Sex hormones can make women more sensitive than men to the effects of drugs. So, emotional wellness. With emotional wellness, one needs to practice self-care, induce relaxation, stress reduction with coping skills. One should be aware of the negative and positive emotions and learning how to cope with each. People with healthy emotional wellness, as we stated, feel confident and in control of their feelings. The next slide speaks to emotional wellness. And some of the positive aspects of emotional wellness for women. So, one should have a rational approach to life, understand who they are as an individual, just knowing who you are. Sexuality, understanding your sexuality, where you are with that. Assertiveness, speaking up for yourself. Not being aggressive, but just assertive. Having an effective mode of communication, understanding conflict management, having good social skills. How do you get along with others? How do you interact with other people? Relational aspects, emotional intelligence, self confidence. Where are you with that? Self-talk. Are you able to talk yourself out of things or into things that you know you need to get done and get accomplished? And how do you view yourself? When you look at yourself in the mirror, what do you see? How good are you at problem solving? Can you work through things? Decision making. How good are you at making decisions? Setting goals, stress management. All of these things can help in the building of your emotional wellness. Now, what is the route to emotional wellness? How do we establish emotional wellness? Remembering to be optimistic, the glass is half full. Seek or accept help. How good are you at accepting help? Sometimes I'm very bad at that. I want to figure it out myself. Create gratitude in your life and in your relationships. Are you thankful? Are you grateful? When someone does something for you, are you grateful? Do you tell them that you're grateful? Learning to accept mistakes and how to learn from them. Increasing self awareness. Improving internal messages. Dimension 2 is your physical wellness. Physical wellness is affected by physical activity, healthy nutrition, and adequate sleep. I don't know how well I do in this one. This is probably my weak link. How many folks, physical wellness? There are many examples of physical activity that range in levels of intensity from light to vigorous. Maintaining your physical health can include anything like yoga, bike riding, jumping, rope, engaging in sports, running, walking, jogging, skiing, dancing. I love to dance. Tennis and gardening. I do gardening. Oh, so I am on this list. Many people use smoking as a coping. I don't do that. Unfortunately, this method of coping can lead to a number of physical health problems, including heart disease and cancer, and can increase one's chances of a premature death, which I think we're all pretty familiar about that. SAMHSA states that smoking related illnesses are related to half of all deaths of people diagnosed with a behavioral health condition. So keep that in mind. Keep that in mind. It is said that women who use drugs can have issues related to hormones, menstrual cycle, fertility, pregnancy, and menopause. In addition, women themselves describe unique reasons for using drugs, including controlling weight, fighting exhaustion, coping with pain, and attempts to self treat mental health problems. So, we had mentioned these issues earlier in the physical wellness, but the one thing I wanted to highlight is the self treatment of mental health problems. How many people in here tend to uh, smoke or go to the substance or drink because they are bored or because they feel depressed or they just broke up from their boyfriend or whatever's going in their life, somebody passed away or someone like that, something like that, and they tend to self-medicate. So keep those things in mind. Wellness can provide a recovering person with tools to build a healthy lifestyle. Recovery, remember, is a gradual process that occurs over a long term. As a person gains distance from your substance abuse, you increase the opportunity to build one good habit after another. So just remember that. Every day that you're here in treatment is a day sober. And I just want to emphasize that. As a person continues to recover from a drug or alcohol addiction, they can replace their bad behaviors with new ones, healthy ones, beneficial behaviors. Okay, so let's think about physical wellness. Recognize the need for physical activity, diet, exercise, sleep, and nutrition. Causes optimum health and functioning. Nurtures personal responsibility for one's own health. Helps to identify improvements, successes, and recognition of improvements needed. Good health starts with a healthy diet. I should know that. Eating mineral and vitamin rich foods is essential to a balanced diet. Not only with a balanced diet, improve your physical wellness, your mood and mental health will also improve. Also, a regular balanced diet can help undo the damages of addictive substances. Yes, that's why when you come into treatment, we give you a regimen of vitamins, like a multivitamin, like especially folks who drink alcohol, we give them folic acid, things like that. Try to replenish those vitamins and nutrients that your body hasn't been getting. Avoid processed foods. Drink a lot of water. I need to take that advice. Nutrition goes hand in hand with physical exercise. Staying fit is necessary. Understand that nutrition goes hand in hand with physical exercise. Staying fit is necessary to facilitate your wellness. Try a variety of different physical activities and find one that suits your lifestyle. I think that's a major problem with individuals. They all want to just start doing all these things, and then you're like, oh, well, I work, I can't fit that in. Okay, so you need to find an activity that you can do, even if it's just sitting in a chair and doing chair exercises or something, but some type of physical activity. Aside from lowering stress levels, exercise is a proven way to reduce your cravings for addictive substances. When you work out, your brain releases some feel good chemicals such as serotonin and dopamine. So just remember that. Once you get started, the hardest part is just getting started. So if you sit and you get started, so then get that serotonin and dopamine just starts to take over, and then it's all good after that. Women who use drugs may also experience more physical effects on their heart and blood vessels. So keep that in mind. So you want to definitely keep that in mind in terms of your health. Uh, Women, heart and blood vessels, those are major things to be thinking about with your physical health. How do I obtain optimum physical health? Well, of course, it can be achieved if you appropriately use the medical system to support optimum health. So that means seeing your doctor regularly. Come on, make your appointments. Following up with your care. Um, Abstain from illicit drugs, of course, alcohol or tobacco and excess. Exercise regularly. Have a lifestyle that promotes physical strength, stamina, and flexibility. Learn about and practice proper diet and nutrition. Self monitor to discover any warning signs of poor health and respond accordingly. Thank you very much for coming. Today, we addressed the emotional and physical wellness of the 8 dimensions of wellness. We discussed and defined the definition of wellness. Also gave some options as other options as to defining wellness. We also spoke to why wellness is important. And we also reviewed some statistics and for men versus women. Our next session, we will discuss social, occupational, and financial wellness. And there will also be a homework assignment for our next session, needs versus wants. And we will go over that, and I will explain to you how that is to be completed. And that is to be turned in during the final session. Thank you, as I stated before, for your attendance. And I hope everyone has a wonderful day. Thank you.